Good evening, all. We will start a session in a couple of minutes. Till then, you can scan. Can you see this QR code here? The audience can scan the QR code and you can poll your vote. We will wait for 2 more minutes so that people can join. I think we can start the session. We'll keep this poll to the end. Hi, all. Good evening, and welcome to our third user group meeting. So today we have two awesome data storytellers. So recently we know that we had an iron whiz competitions, and I was browsing through various visualization, and these two people's visualization got very interesting. I found it very interesting, so I called to speak for our sessions, and they have agreed. Thank you, Anjushree, and thank you, Praveen. Well, we welcome you for the third meetup. So let's start our session. The first session will be from Anjushree, and so I want to introduce Anjushree. She is a data visualization and Tableau enthusiast. She enjoys combining business strategy with design best practice to build innovative dashboards. Currently, she works at Altus Group as a senior BI analyst, where she is responsible for creating dashboards for executives and clients in the construction industries. Welcome, Anjushree.
Thank you for having me, Solomon. Good evening to everyone and good morning to a few of us here. So let me pull up my screen. Yeah, so today I'm going to present about the infographics, the role of infographics in healthcare, and how can that be made more interactive. So just a little about me. I work as a senior BI analyst at Altus Group in Toronto now. Prior to this, I worked for Ernst & Young for around 5 years, both at Bangalore and New York. I love data visualization, data art, and Tableau is one of my go-to tools for that. I've been very active in the Tableau community this year, and I've had 2 VOTDs last month. So in my free time, I'm a very happy doodler and do that for hours long. In case you want to reach out to me or follow my work, that's my Twitter handle. Okay, so let's start off. So what are infographics? Just give me a minute, please. Uh, yeah. So what are infographics? They are a visual representation of very complex data into an audience in a very simple manner that can be easily consumed by them. They're
Sorry,
very
and just sure you're sharing your presenter view right now.
Oh, I'm sorry. Let me kind of move that up. Yeah. Does it look good now?
Yes.
Yes. So these are very powerful digital tools. And there are various reasons for that. First one is the visual simplicity. The kind it makes it very engaging, and the target audience could even be a layman who knows nothing about data visualization or BI. They're very accessible. They're very easy to understand, and this kind of reduces the boredom. Infographics are a mixture of text, bands, icons, and images laid out in a very neat format, which kind of awakens interest in the user, and they're very attention grabbing. So it becomes like a really good story kind that they can understand the bigger picture and drill down and make some sort of assumptions as to what it is telling you. So interpreting and conveying complex data, it wouldn't have been so easy without the infographics. They're such powerful communication medium that not just IT sectors, but even the unusual sectors like healthcare and medical sector have also adopted them. And why is that? There are a couple of reasons for that. It, it's majorly because it can magically transform very intricate information for patients into interesting graphics that are very engaging and easy to comprehend. This way, they get to see a very bigger picture in an easy manner. As we all know, medical information can often be very difficult for a layperson to understand. For an average person, it's just too impossible to visualize the systems of his or her own body and to be able to understand what causes what and how that leads into something else is very difficult to visualize when someone's giving you a lengthy explanation, and not to mention all the difficult terminologies, medical terminologies and jargons that's been used. So on the other hand, infographics tell a story. They keep them engaging throughout, and then it makes them understand uh, how one thing is causing another. Like, for example, it could be how the symptoms of a heart attack can lead to something more serious. So when you explain the arteries and nerves and what's causing what, it's kind of very difficult for the user or the patient to consume so much of information. But when put in a very visual format in a proper guide, it becomes very easy. That comes to my next point. People focus more on information that is visually stimulating. So a nice combination of vibrant colors and good attractive typography is definitely more appealing compared to a few pages of pamphlets or handouts with just plain text. So because human eyes are always compelled towards something that stands out from the rest of it. And it kind of leaves an imprint on the subconscious mind. So yeah, keeping it visually stimulating is a very important factor in here. And the third one is it provides a visual guide. Oftentimes what happens is complicated concepts, they involve multiple steps and they can be quite challenging if they're like very in-depth instructions. For example, if we had to give them, if we had to give a patient an instruction on how insulin has to be self-injected, the very in-depth text instructions can be very hard to follow for few people. However, if it's laid out in a visual way, an image for each step with very minimal text, it becomes very easy to follow. And the fourth point is they are highly customizable. That's one of the powerful feature of infographics. You can customize it to have your logo, your brand colors. You can lay out the charts with the brand colors, and you can put in your information about the business, the nature of the business, or you can put in the website details, a call to action. It can be customized in every possible way. And they're exceptionally shareable. They can be shared across multiple platforms online, embedded, and shared as an image, what and what not. Like every business wants to build an online presence. And what could be more better than a beautiful piece of infographic to achieve this? And the last beautiful point about infographics is it kind of improves the health literacy. Empowering patients with the right and current information with leading innovations is very hard due to the content overload, basically. But infographics makes it so much easier and keeps people on the same page in their understanding because they're not very, very complex to understand. So here's just one example from my iron whiz about leprosy. So at the left, I kind of have a bunch of text. What happens in the text is user does read and he knows that there are kind of so many countries or so many cases. But when it is visually represented on the right side here what's happening, I know that these are the global cases. And immediately to the right, there's a big band saying like 60% of it comes from India. The map and the bomb chart kind of helps me to understand that India has been in the top position for more than 2 to 3 decades. And the map, it kind of shows me that most of the top 10 countries are coming only from 3 or 4 continents, and they're not worldwide. So these things kind of really help draw users' attention, and the kind means that the color has been used. The user's attention directly goes to that. It kind of tells you that these are your main parts in the green, which are catering to leprosy on a high level. And here, as I mentioned earlier, infographics are a great visual guide when you want the user to go from step A to step Z in a very formatted way. So the chart, funnel chart to this right kind of shows you here. So it is kind of telling me the reasons why India is lagging behind and has so many cases. So the green parts are the leprosy cases, and the grayed out, it kind of is showing me these are the main reasons why people are dropping out, or why there have been constant high number of cases. At the beginning here, I kind of given a gender split up and then tell that most of them go unreported due to discrimination and stigma. And once they are in, most of them don't even go for treatment anymore. So that kind of delays your detection, and then the transmission continues. So even after they go and get admitted, most of them drop out in the mid without completing the course. And that is again another big reason. So again, in here, like they say, seeing is believing, right? You might say that these so and so are the states where there are very high number of cases, but it might not be retained in the user's mind. What's happening here is the color immediately lets the user know which states are on the radar on different parameters. So what happening in the box plots is, for suppose Maharashtra, it has a high detection rate in the urban area, and the scatter plot below shows where does it exactly stand in comparison with the other states. It becomes very helpful this way, and the locations of the leper houses are plotted on top, which kind of even makes it very helpful to know which states are in importance and where are the research institutes and things like that. So I will actually move on to the Iron Viz and show you the interactive version. Is my screen visible? If anyone could confirm that.
Yeah, it is.
Okay, yeah. So this is the interactive version of the entire Iron Viz. So the first section gives me the global overview, and then it tells me what the current scenario is. The big bands make it really easier this way. And the way we can make it interactive, there are different kinds where we can make it, which I will talk later. But then in here, in this Viz, I have the toggle. For a more in-depth analysis, only if the user chooses to know so. So I have the percentage of children, how many females are there, or how many are going to G2D, which is like the grade 2 disability, and where India stands among, which becomes very easy to know where our country stands, among others. And also I mentioned about the leper house locations. So another interactivity is on hover. So in case we wanted to see about this leprosy hospital, you hover over it and get much more information in case the user chooses to, so that we're not cluttering the infographic with loads and amounts of data, which is very difficult for the mind to timeline as to what India's efforts were and what events were kind of milestone. So I'm not putting every detail onto it. And is visibly very easy to know what the progress has been throughout like 100 years and which states are still on the radar. The last portion, the beauty of infographics is you can always put in a call out to action, wherein a user, if chooses, can go and either donate or can visit your website, or if there is any kind of action you want to put in forms, you can do so. The very impactful thing about infographics is your use of images and text in a way that kind of draws the user's attention. There's another one that I would like to show you. So this is about the Human Disease Network, and this was my VOTD last month. So here, it might basically look like, what's this? Yes, I'm sorry. Yeah, so here I tell how many disorders are there, how many kinds of diseases, and how are they linked to how many of the genes. So the small yellow dots in here are the genes and how they're connected. You can actually highlight on a different kind of disorders. Let's pick up cancer. These are all different kinds of cancers in here. If you pick up colon cancer, so it's linked to 34 different genes and has 50 associated diseases. It basically is telling you that there are 50 other diseases that can lead to colon cancer, or if you had colon cancer, it is ultimately associated to other kinds of cancers. So this is a very nice way to put across and give users an ability to kind of highlight on the ones that they want. So going back. Yes, so how can I make it interactive, and is it a good choice to make the infographic kind of interactive? Now that we have the ability to kind of embed our own Tableau views into your blogs or website and let the users interactive, it's a very great, powerful tool that you can incorporate into your infographics, because everyone's doing infographics. What is that you can do to stand out among the millions? This is definitely one option, and you can do it through different ways. First one, I would call it navigation. You can put in you can have a scrolly kind of telling, or you can have buttons to navigate through pages and back and forth through animations. That is one other great feature, to have your user kind of be amazed by the animations. And you could put in an interactivity in a lot different ways, like the toggle views that I showed you, or you let the user put in threshold values and kind of changes the view for them. That's a great way too. And you could put in built-in user forms for them to kind of fill in and have the filters or kind of custom experience. And the third one is the call to action, like I told you before. It is something that data journalists and a lot of corporations use, and we should definitely take advantage of that one. So yeah, it's my case here, and I hope most companies use the infographics in healthcare, because that is something which is totally trending and helps patients understand the kind of complex information in a story kind of telling, which is much easier to comprehend. In case you want to see much more infographics, surely not about healthcare, you can always visit my Tableau profile. So thank you for having me, Solomon. I would take up any questions if there are any.
Thank you, Anjushree. It's a nice presentation. We have learned how to use navigations and other interactive tools to do one interactive infographics. Uh, for- from the audience perspective, I want to ask a question like, uh, we have also the healthcare professionals who are not from an IT background. So what would be the learning curve for people coming from healthcare background who don't have much experience in Tableau to learn these kind of interactive infographics? Or are there any resources for us?
I would say I wouldn't definitely opt them to kind of learn Tableau, because if you're applying Tableau as an enterprise solution, then yes, but there are definitely different ways other than Tableau that you can make your infographics just through either Illustrator or even open source tools like Figma. So it's necessarily not needed that you do it through Tableau itself. There are other platforms, even open source, which anyone can learn. It's pretty easy, even if they're not from IT background.
Okay. So do we have any other questions? Right now, we don't have any questions. We'll take it to the end. And thank you, Anjushree. Let's move on to our next speaker. So the next speaker is Praveen. He has been working with UX-based dashboard design for almost half a decade. Currently, he is working as an user experience designer and data visualization developer at the Bosch Center for Artificial Intelligence, contributing to integrating AI with every product at Bosch. In the past, he has worked with sales, marketing, finance, FMCG, and airline domains. He specializes in UX wireframing and design, advanced business tablet dashboard development, corporate branding based design, and user centered dashboard design. Welcome, Praveen.
Thank you. Thanks for having me. It's really a pleasure to join here. Yeah, it's a first of a kind for me. I done one of the healthcare presentations at the global presentations for Health Club, but yeah, after that I've never done anything for India in specific. But this is the first for me, and I would say it's really awesome, and there's no doubt to that. Yeah, I'll start off by presenting my screen, and here we go. So just let me know once you're able to see my screen and I can kick off from there.
Yeah, it is visible.
Great. So I'll put it into presentation mode, and there we go. So, yep. So hello. So I'll be presenting on the topic insight over information at healthcare. So that's the whole overall mode of this topic. But it's something that I've always thought in the past, that some things that are in healthcare, that's the difference. There's a difference in data, how we process, and compared to other businesses, the amount of data that comes up in healthcare is actually very extensive, even though people don't really talk much about that. But I consider that the amount of data that comes in is enormous, and to make sense out of it, it's something that really is upon the person and about the developer who makes out charts and visuals. It's sometimes becomes more than complex. So my way of solving that topic is insight over information. So there's a huge difference. When you visualize something, we have information, but we do see that KPIs are more visualized in that, and people find more information and try to make sense out of it. That's very good. But once the amount of data increases, the only thing that matters is insight, and how can it drive a business, or how can it drive a decision making point. So we'll be looking into that today, and I'll start off with a personal intro. My name is Praveen. I work as a data visualization specialist and user experience designer at Bosch Center for Artificial Intelligence. It's based out of Bangalore right now, but we're spread out in 3 different locations across the globe, starting from Silicon Valley in California, US, and second location would be Runningen in Germany, and third in Bangalore. In Kormangalore, we have a division working towards AI influence and integration with Bosch on a global scale. So that's what I do for professional work. I also lead the Tableau Center of Excellence at Bosch, and but that's on my work. What I specialize in is BI dashboard design, conceptualization, corporate branding, and a lot of user experience based design. So that's the difference, right? I mean, instead of designing with just dashboards, I think into more user experience design where you have a user group which is larger than 1,000 people. That's where it kicks in, and it really helps people to design dashboards a little bit more interactive and intuitive designs. That's the word I would like to use. So pretty much that's on me. I don't want to brag that much about myself, but if you'd like to reach out to me, I'm available on LinkedIn. It's a pretty same name, Praveen Jose. You can search out my name and you'll find it out. So that's about myself. So I'll move on to the topic for today, which is what are insights and how to bring them to light, technical methods and examples. I would like to keep it very crisp. I'll be inducing more into verbal conversation, and then from there I will move on to Q&A. So yeah, I want to keep it extremely simple. That's the whole idea. So what is insights? That's a very simple question, but very difficult to answer. So I consider insights in 3 ways. So insight is a key aspect of a KPI. It drives business and it is prioritized over several points. So I'll explain each of them in brief. KPIs are something that we believe, and it is true, that runs a business. Let's say profit ratios, profits, that's into core business. If it come into medical terms, then it could be something like a ratio over overall numbers. It could be a overall percentage with respect to global community. Could be anything. So a KPI is something that technically drives the business, but an insight is the key aspect of a KPI. So insight is actually prioritized for me over a KPI. You can have multiple KPIs on a page, but what's the insight that you're trying to guide the user to the inference, that really matters. And that's why it's a key aspect of a KPI. So even though if you see a pie chart, which is made out for a KPI, an insight actually is something that comes out of it. It stands out, and educating the user, telling that this is what you got to focus, to run your business or to run a decision-making process. Second, it drives the business. So we have multiple KPIs. We have the percentages over the global scale. We have numbers. Everything checks out. But what drives a business is the insight of what needs to be focused, right? So we have a lot of data points for a KPI, but we don't know how to run a business with that, or how to drive a decision-making process with that. So an insight drives a business. A business in terms could be anything. It could be as simple as running a literal business, to driving an insight, to driving sort of like information to a couple of folks in your community. Third, it's prioritized over several points. An insight, I would say, is something that could challenge even the existence of a KPI, and it could come up to a point that in a dashboard, that's the only thing that matters. There's nothing that really cares about, but the insight is the only thing that matters, and people can take it to conceptualize and derive new KPIs itself. So it's even that more prioritized. So that's why it's prioritized over several points. It doesn't really matter what it is. That's the end goal of your dashboard. So I mean, this is definitely good on a theoretical note, but what does it mean in terms of literal numbers? So I will move into an example. Very simple. I have 2 examples now coming on for what is an insight and how do we use it in the technical process. That's the second round, right? So the second topic for that. So we have a perfectly executed requirement here. We show the ratio over months. Let's assume the ratio is compared to any medical term. You have data and keep it generic as possible. So it looks absolutely remarkable. You are showing the information, looks good, and it drives your purpose. Your purpose was to visualize ratios over quarters, and it gives a very good perspective to your community. But that's what you think when you design it, right? But what's actually happening? So what a user considers really is this. That's all that matters. What's highlighted is all that matters to the user. Everything else is just sort of like extra information. It's good to have, but it's not must to have. There's a difference. Some things that good to have and some things must to have. So what's must to have was this, which is there in the list, but it's not that prominent. So that's where everything goes for a toss. Right? So it doesn't really work. So this is what the user is really worried about, or this is the insight that the user is looking for, but we are actually giving him this. So that's where something is going wrong. Now, if you take it one level further, so when a user actually views this chart, this is what he sees typically. So he sees his insight, which is pretty much grayed out, and the entire value is grayed out, and the value which he needs to focus is so small. So how do we technically enhance it? So typically people see this as an option like comparing to the global values works well. But if you like to focus only on that insight, we change the chart, we exclude everything out, we only focus on our insight. So this is how typically the insight gets visualized out. So we are separating we have the KPI, which is a ratio, stays as such, but the insight modifies the entire dashboard. So now your views looks like this. So this is good, this is still good, but we need to give something called the patterns for the user. So patterns are something that drive the insight. So we see the insight over larger data points, and we observe certain patterns which are really important for business to run. And these patterns are actually that make real impact on the community. So how do you bring out the patterns? So technically you go to Tableau, you right click the axis, and you say remove zero compatibility. So anything that's starting off from zero, you don't really need. You want to see something where the patterns emerge. So Tableau will automatically calculate that, and it will remove at the zero, and it will bring out the patterns for it. Now you see patterns are absolutely clear. I mean, you can make sense out of this information. You can say, you know what, this is the insight that I was looking. It is perfectly designed, and it is visualized in such a way where I can see the patterns very clearly. This is what really matters, showing information like this to showing information like this. There's the difference. With this, you can take hard and fast decisions. With this, it takes hours to take hard and fast decisions. Now that's where insight really works. Let me show you another example. So this was the one. Let me take another example of seeing ratio over discount. So discount is technically a business term. You can replace it with anything that you provide. For the purpose of bringing out a scatter plot, it's actually really more usable. So this is how it works out. This is the information that is visualized, looks very good, right? And as a technical developer, I'm very happy at what is shown. Really makes sense out of it, But for me, it works because I have all the data points. People can hover over each or select each and make sense out of it. But for a user, what really matters is this. So if you see my screen, only the points that are highlighted is all that matters for the user. It's the same example, just a new interpretation of the previous example. So if you see this is all that matters to the user, right? So technically what the users would like to see, if you're showing information highlighted, this is what technically the user would like to see. It's popping out, and this is the what he values out of the whole bunch. This is what he wants to see. I mean, right? So to make our business decisions. But as a technical developer, we try to see the patterns. We try to enhance the insight. But this is good enough, but still, how can we bring out the patterns clearly, right? So we take it one level forward, we remove out the other values. We try to see these are the values that can run the business. They're very clear, and they are showing us the patterns on how they exist in the actual data, and people can take decisions over that. So pretty much, if you see the examples that I've shown till now, you get to see how the value has traveled over time. If you see over this, and how we are actually trying to isolate the insight out of the information, is actually a stepwise process where you try to enhance the insight and suppress all the other values and bring out the patterns like this. You have the information here, you try to highlight the insight, you try to give it a purpose out of the other values, and you know, this is one way and this is another way. You can bring out more of the driving process. You can use this to run an actual process or influence a community that is near you, so that you can tell them, you know what, this is what matters, you know. So totally up to it. Let me tell live examples from some of the dashboards that I published almost a year back. There was one dashboard that really influenced me. It was about Alzheimer's. I made it out for Project HealthWiz. It was a clinical test-based study for Alzheimer's, and it actually shows up the companies that actually do the manufacturing for Alzheimer's-based medicines over the years. So we see that over last 10 to 15 years, there's been significant amount of companies that are testing out products for Alzheimer's. But we see that the pattern, you know, somewhere in the mid 90s or 98s, the values are, there are some significant research. Then it has declined over here. There is some traction over here. And then at the end, we see Roche picking up here, and we see Novartis picking up here, which is significantly good. But what I'm trying to say is we have this information over here. We pick out the insight that we want to highlight is like where the values are really creating impact, highlight it, bring it to the user and show them the total value. So this is actually driving your technical expertise or your user community, telling that, you know what, we had research happening for years, right? A number of years, but this is out of the total years that had significant touch points or influenced actually the research on Alzheimer's. So this is one example of how we can bring about that, and you know, really picks up that values and all that. So a very simple example. Almost a year back, I created this fix, and yeah. So I'll take you another example. This is even more old, maybe a year and a half back. This was on STDs in the United States. So these are the top 15 states by STD numbers. And if you see on the top, the way how we read the chart is provided is actually the years. So if you see 1 is 2001, and it goes up to 14, which is 2014. So you see all the values for 2014 to 2001 to 14 for every state, and it colors off by low STD to high STD. So if you see, you can see the patterns. Actually, that inspires me and helps me to run my business every day. You know, so influencing people to see the patterns of data that is existing, and you know, people can easily make out of it. So if you see here, applying the insight-based process here, we see we have the KPI, which is count of STDs, which is perfectly fine. I could have shown this in a bar chart and close it off, but what actually happens is once you try to highlight out the insight and show that, you know, even within the KPIs, you have a demarcation, you have some bias or some distribution of values over the KPIs itself, it's very easy for people to visualize something in this form. Although it looks simple, it looks impactful, it's nothing so you know, so demeaning. Although this is a very huge impact on the community that something like this even exists today. But to highlight a topic like this to a community in a way that it is not personally impacting anyone, it's not creating a negative impact on the community, a visualization like this really brings out that, so people can really see that, oh, you know what, this is how it really works. This is how the STD values, even though it's a KPI, this is the spread of the values within the entire data set. You know, so. Well, that's all about insight that I would like to convey. So insight is something that really prioritizes over data. And even though the KPIs exist and people think that KPIs can help us, if we have percentages, ratios, numbers, they can help us, but it's very good. But you need to use that to influence a community or to run a business. That's the question there, right? So how do you run a business with that? You try to find out the insight that you like to communicate to the community, and you highlight that insight and you showcase it to them. So that's the whole plan behind that. Yeah, I think so. I'm done. You can use the time for Q&A if there's any, and then I will take it forward from there.
Thank you, Praveen. Yeah, we learned that there is a fine line between showing information and showing the insights. So it was very resourceful.
Absolutely.
Yeah, it was very useful. And I think the audience questions.
All
Okay.
right.
Yeah, there is no questions. I just want to ask, what are the good resources to develop our Tableau skills?
That's a very generic question. I would say, um, well, start off with blogs. There are a couple of blogs that I know by Toan, by Ken Flalarge. There's absolutely remarkable websites and blogs available. There is a data podcast by Zach, which is really good. And the idea to improvise is actually to hear as many people as you can and how they actually use data. It's not about the tool. The tool can be mastered in a
Mm.
day, on a week, in a month, right? You can absolutely become an expert in Tableau within a month, but how to use it to run a business, or how to use it effectively to derive insights, to derive information and drive a community to influence people, that is really the question. For that, you definitely need to hear out more people, see the methods that people really use in Tableau to derive insights. It's pretty straightforward. Everything's a bar chart, everything's a dot plot. There's scatter plot. Everything's the same. We don't have so
Yeah.
we don't get any new charts just for ourselves to create. It's the same bar chart, it's the same line chart, but how do we use it? How do we use Tableau to build something that is unique, that is something that drives a community? That's the whole purpose, that you influence a community to influence the business or to run a business. That's more important, and that you can gain by reading a lot of blogs. I personally list a couple of blogs, as I told, about Toan, about Kevin. Those are really good. And we have Rajiv's blog. He works out of APAC. Absolutely beautiful. I mean, if you don't miss that out, then I don't think so. Within 6 months, why can't you be the best? I mean, anyone can be the best at Tableau. There's no doubt to that.
Absolutely. Yeah. Thank you, Praveen.
Thank you.
Um, yeah. Thank you, Anjushree, for the inspiring session, and thank you, Praveen, for the more useful contents. And I like to thank all the attendees for joining us. And our next India Healthcare User Group meetup will be communicated to you all through mail. And also we will upload this video in YouTube in couple of weeks. Thank you all. Thank you all for joining.
Thank you very much.
Thank you.
Thank you.